Hello everyone, welcome to my channel. I'm T Zion, and today I'm going to take you through the process for angioplastic surgery.
You want the best of my heart, you just gotta see the good in me.
First of all, I'm going to teach you on the basic that you need: body grooming and how you prepare yourself for the angioplastic. For me, I had a plastic surgery 2 days ago and I'm doing quite well. I can move, I can walk around, only that I cannot use my right hand to do anything. Even when I'm holding my phone, I'm holding it so that I don't hurt myself on the place that they used. We are starting process 1. You need to attend the hospital a day before the surgery for your blood test. So the blood test they are going to take from you, and also to sign a consent form. That one you have to go 1 day before the surgery day. They will take your blood test. The blood test they are going to check all your immune system, if they will match with the medication they will give you. They have to check if you have cholesterol. They have to check if you have pressure. They are going to check if you are pregnant. If you're a woman, by the way, if you are pregnant, the blood test they are going to check all your immunes. On that blood test they are going to check that day. After the blood test, they are going to give you a form, the consent form that you have agreed to go for the surgery. That is a day before the surgery. So the form they are going to give you 10, at least they have 10 rules where you have to follow. Depending on each and every hospital is different from another. So the form, the doctor is going to go through with you to the form one by one, each and every step on what you need. Like here in Qatar, the form is different from what I talked with other ladies or other patients who have done this in other countries. I was discussing them about the form, and I found the form here in Qatar is different from other countries, because in Qatar you will see procedure 3, the plastic surgery, they have medical and they have free. So you opt in what you want to pay. You want to pay 2,000 riyal for the stents, or you opted for free. So here in Qatar they have done something quite amazing. They are very caring. If you choose free, they will put the stents for you for free. So like my stents now, it's for free. That is, the government will cater for it. That is, the Qatar government will cater for it. I only have to pay for the bed, which I paid 200. Later on they refunded 100, and they cut 100, because the insurance will cater for that if you have a health insurance card. So also they will tell you, the form they will tell you have to shave. After shaving, you need to take your medication in the morning, the normal medication that you are taking. They will give you some of the medications that you will take that day and the following morning that you will take before the surgery. And also drink a lot of water. The doctor will go through you the whole steps, and then the doctor will show you the stents. You see how it look like before you sign. After you're signing, so we are coming to the morning of the surgery. Step 1. You have to arrange your own transportation coming to the hospital. You have to be there 30 minutes before the time that you were given. For me, my appointment was 6:30. So they told me I can be there at 7, which was not a problem for me. That time I'm always awake, but I arrived late. And also when you're arranging for the transportation of coming that day, you need to have one person with you. But in my case, I didn't go with anyone. I just went alone. Through all the process, I went alone. That is, you have to arrange your Uber or your transportation, how to go to the hospital at that time. Step 2. You need to go with your health card. And your health card has to be active. When your health card is active, that way they can make sure that everything is intact. So you don't need to look for going around again to renew your health card, because they need the insurance health card to be active for the process to be easy. When you arrive at the hospital, you will first of all, you have to go to a hospital cashier. You will find an attendant, but in my case, I did not go looking for my attendant that time. I just went direct to the cashier and I told them I have an appointment for my angioplastic. So it was easy for me. They just told me pay here, which I told them no, put it as plus. I will pay it later because it's under company, and they had to agree. So I had to stay there like 20 minutes, because the line was, there was a queue there for people who were paying. I had to wait. They make some calls to see if it can be plus. I will pay later on, because according to the hospital, you have to pay for the bed first before you are admitted. But the nurse has to be, the receptionist, they had to make a lot of calls asking if this patient is okay, like that. So I stayed there for 20 minutes and they agreed to allow me to go through. So I paid later on. Number 2, you need, if you have a secondary insurance information, that is if you have somebody else who is going to cater everything for you, you need to come with other information from that. For me, this secondary insurance information was under the company, so it didn't have any problem. I just gave out my card, health card, and I told them everything to put under the company, So I allowed the company to cater for everything, and then I called the company. I told the company nurse I'm already going inside, so the company nurse said no problem. So the company will deal with them after my surgery. Step 3, you need to come with all medications that you are taking previous. When you are going for the day of the surgery, that is step 3. You need to carry all the medications with you. My friend, I'm telling you, my viewers, I had a lot of medication because on 25th, I had already received another medication set, different one. So you have to come with all the medication that you are taking, because the doctors have to go through. That is the nurse who is signed on you that day of the surgery will have to go through with you on the list of the medication you are taking, or maybe the doctor will change afterwards. They will tell you which one and you are going to use after the surgery, which ones are important and which ones are not important. So you have to carry all the medications during that day. You have to go with them. Step 4, once you are inside, after you are done with the reception, you are done carrying your medications, now you are entering inside to see the nurse on your bed. The nurse will come and discuss with you all your allergies. The nurse will discuss with you if you have an allergy, so that when these allergies are, maybe if you have an allergy on a medication, if you have allergy on food, because they have to take your details. In Qatar, it's very nice. They have to take the allergy details, especially on food. Me, on my side, I'm allergic to anything concerning milk, cheese, creams, anything creams or milk. We are not compatible. I have I'll start just soiling on my hands, my face. I'll start scratching my body. So that is the only problem I have. And also, I don't use this medication, other type of medication. I forgot the name, sorry. There is a type of medication I don't use that the doctors, I informed the doctors and they were like, okay, we cannot give you that one. You will not need it anymore. So I had to state them down. And when they bring your food or when they bring your file to you, they come with that list of the things you mentioned you are allergic to. Whenever the nurse will visit you, they come with that list so that they are updated. Step 5. Keep in mind that depending on the hospital, you will stay an overnight there. After the surgery, you might stay overnight there. Some hospitals, after the surgery, you will go home after 6 hours or 12 hours. And other hospitals, you will go after 24 hours, you will sleep there. So depending on the hospital and depending on the doctor, that is how it is. For me, I stayed overnight. So the doctors will inform you everything. You are going to stay with us overnight because they have to monitor carefully how you are going on. Maybe you have internal bleeding, maybe you feel pain, maybe you have headache, maybe there is a kind of funny reaction with you. So the doctors have to stay there with you. You have to stay there. So keep in mind that you will stay overnight. Like in Qatar, for me, I had to stay overnight. That is their procedure. That is their logical procedure where you have to stay overnight. That is not by your decision. Like me, I was like, I just want to go home. After the operation, I want to go home. And they told me no. According to the hospital law, that is after angioplastic surgery, you have to stay overnight. And also before they have an appointment, that is after every 3 months after the angioplastic. If you check on the Google, they say the first checkup should be after 3 months. No, with the Qatar here, HMC Heart Hospital, it is after every 2 weeks. They have changed that procedure. They said after every 2 weeks, you need to have an appointment. So my first appointment will be after 2 weeks. That is the best for Qatar. They have to follow up with you. And one thing about this hospital, they are so much caring, you know. They are like family. They are close to their patients. They make their patients be comfortable, feel comfortable. Point number 6. Make sure you have a responsible adult after the discharge to take care of you for at least 24 hours. After you have been discharged from the hospital, have somebody to pick you up, somebody who will take care of you after you have gone home, because your hand or your leg where they used, one, you're not supposed to put water there. When you go to take shower, you're not supposed to put water there. You have to wrap it so that the water doesn't go through. Like in my case, they used my hand. After the whole discharge yesterday, I took shower and I had to wrap with a towel so the water doesn't go there. Then today I changed the bandage, because you have to change bandage for three days. You have to be changing the bandage so that it's look clean. Right now I've just changed. After shower I have changed it. It's look clean and fresh. Also, you don't need to cook. That is how they inform me. I don't need to cook. You don't need to also drive until after 1 week. That is the way I was told. So you cannot drive or you cannot cook for 1 week to avoid the heat going if you're using your hand, or if it might also do the bleeding again, because you know these are veins. So you might use the whole effort when you're driving or when you're cooking and you're lifting something and the bleeding start again. So you have to avoid that. Point number 7. Plan for your own ride. That is after going home. You have to make sure you have somebody who will come to pick you up. You know, you have to call Uber or a friend who can drive, so they have to pick you up because the hospital cannot take you again. So make sure you have your own personal transportation going back home. Then the most important thing, this is an additional. If you are a woman, this is for the ladies. Make sure your nails, you don't have any polish on the day of the surgery. I went with my nails, they have polish, and I gave them a hard time because the hospital, they did not have any acetone. You know, the nurses, they don't apply their names. So the whole hospital, they don't have acetone. They had to be going around the nurses looking for acetone. So this is point number 8, ladies. Make sure you don't have nail polish on you. Second, make sure your hair, you need to tie it at least so that it can reach on the hospital's cape, that chapeau, when you put on. My hair was bulky because no one informed me about it. My hair was bulky. So whenever I cover myself for the theater, the cape would fall down and I had to tie and tie and tie. So ladies, make sure you have your hair when you're going for the theater. It can reach on in the chapeau for the hospital. It was hard for me, for them to prepare for me. It took like 15 minutes for them to get me ready for my hair and also for my nails. Point number 9. Keep in mind the operation room is cold. That room, surgery room, is very cold. It's very cold. We are going to talk to on another video. I'm going to share with you another video on the surgery day. Thank you for listening to me, and don't forget to subscribe and also hit on that thumbnail. Also click on the bell to get all the notification I'm going to share to you my journey on how the operation went. Thank you so much.